I would like to introduce you. Lu is from the Torino. She's a PhD student, and she's working together with her supervisors in the systemic. There's two other paper. One is also from Department of Architecture. The other one is who many of you design and research is very active. Department of Architecture and Design, so the Torino. So about is, and you show that there's wicked problems, and it's really not so much about the theory, but actually looking into what it means to on the ground. And Lu, please go ahead. It would be great if you leave a little bit of discussion time at the end, because you see we are getting really into the mood. Thank you. I will mute us on our end here.
Okay, hello everyone. Thank you for and it is pleasure presentation entitled here Holistical Diagnosis of Symbol Design Community. I also collaboration Barbero on the symbol course, and which focus on the use symbol design methodology. Charlie company. But today's Amina start her maternity leave. She gave birth to the new baby. Barbero is still on the bachelor. So I'm very sorry they attend today's meeting. And then the social will include the environment, climate change, economic or regional conflict, and exacerbate security crisis, also including aging population, demographic change, and transformation. Patient in many countries and regions of the world still unfortunately. And also many of the problem which cannot be discrete and then do not have an objection solution, and many public problem by complexity, decision making, omission, and uncertainty in context. And the linear model of the on the determinate problem which have defining condition and the linear approach to the understanding holistic and the shortcoming of the linear approach are also due of the weak problem. Starting with problem require than the linear thinking, and on the contrary, the design is attractive and the deal with the complex strategy, agility, and adaptive capitation, particularly to multiple fields. And the although involving a number of the interesting systems such as the public health system, health policy system, insurance system, and the echo, there are many factors almost in multi-feedback system, and where single cannot identify and hire the care system. Then facing the community most pressing problem in a complexity community care system, interrelate nature of this problem is more evidence, those making the problem even easier. The research goal is to explore the contribution of the symbol design of the complex communication. And the research programs include how to understand the weak and how to achieve the using the tool of and holistical diagnosis. For a holistical diagnosis, systematic design approach of the Politecnico Torino in order to understand design approach has five promote the writing a new way to add output more than the input. The output become input resource, and the process of the output become the input, and developing continuous energy and information relationships, and the relationship in the system general itself, and the third auto policies and by creating their own evolving together, also involve issue of the policy and demographic and which are necessary to address when working with complex system problems. And fourth, act locally. The locals prioritize enhance its unique culture and economy. With first is the humanity weak and interrelate problem are seen through the lens of social and the human being, a wide ecosystem. And in the complex system and system thinking, which developed from the general system theory in the 19th system science and approach. It also has some, so to address this limitation in the 2001 Politecnico Torino development the system design approach based on the system in conjunction with the design math. And John Peter Booth designed a journal through the laboratory of the 4 disciplines to address the complex, and they are general at the scale, but and each design domains hold a distinct, and the design production domain, and the design assistant context can be consider full situation, things context, unbriefable and parametrical and organization. And the system design methodology of perhaps and convert all them and 4 key points. And first is the understand the tracking the challenges and problems, and this step is in scope of the boundary of the for the entire process to address common is design system solution, and this design of a new chemical model based on the relationship and the atom and optimize information and give a value to the solution. And the third implementation includes evaluating the system. The system enable our change intervention environment and the transition. The system operate in a specific actual, so a situation in short mean are divided. And the work and should reveal the correct research and strategy for all contribution to the weak program policy scenario research in order to the info policy marking, community industrial designers, relevant or policy strategy for all political dynasty in weak program, analyzing data of the literature review and the division into 3 different search for better search resource and those faster access to. We will key of the different and analyzing the literature by country, years, and decide the keywords. And analyzing the research is the literature, think about the research status and development trees in the file, and as well as the advantage of the different research of variety type for all order. By the country region show that the top 15s in usually country is the demography should have the and a hay and a hay a charm and to then come with an age. The research and all order care has on the 2016. The increasing the research of the factor almost a growing number of the population in some countries such as the Japan's, and then most contribution are in social science, nursing, and the contribution is still very small and complex changing requirement desiring and what in team to get a deep environment and social systems. And almost the research mass use and the decades through the literature mention the control side review and the extension study and the research and systematical systems and demography program evaluation, focus group, and the event-based approach. And through the summer, the priority of the audience economies volume is self-managed gap in the integrated care people community for all people's Marco, mental, and miracle and care training formal care give and end of the life care of the old people through the government family frameworks for all audience, and they are considered we type the linear issues and do not see it in the holistical way. And then holistical exists in the design path, the comprehending the program in which in the design project. In this step, the holistic scenario consider both levels surrounding the content, energy, and matter through the enterprise to identify scope and system boundary question topic and who and what to research. And geography include the distribution of the number of the inhabitants of the priority of the BM mountain and the distribution of 16 years of 5 years of age and the population from which it can be the sectional then the population density and the general for the 65 years. License can be made of is in the city of Turin based on the geography and the combined. And the demographic data include the proportions of the population of ASL23 community in Italy, Piemonte, prevalence of the or more audience, expectance echoes. The up section show the and the research of the laws on the healthcare and education. It is crucials in the healthcare will be directly related to assist to the healthcare and free healthcare. More people who give of expensive primary healthcare costs and long wait include micro data. About the exercise hobby and eating hobby of the care need of finally conversion between the city of Turin and the prairie Piemonte. A number of the audience care, the number of the audience communicate in ways, and then demographic trip for the next is the most old, not family and not children, so it is difficult to meet audience in it is child share care, and this is because there will be extreme care given in the future. All of the data affect healthcare. This includes the theoretical waiting time and actual waiting time. There is the theoretical of the emergency department, which is divided into the five levels. For visiting a doctor, divided into the 4 levels. Actually, would arrange a hospital staff, Piemonte, Turin, and the ASL23. Hospital stay for time to urgent care back, for long-term care back, and the rehabilitation back. And then the main section focus on Turin and Piemonte can provide 3 community. Is about the ASL23 healthcare institution number. This section is professional and the healthcare data give us a more view of the community system including ASL23 and where the worldwide component in each other, and is the possible to demographic boundary, territory boundary of the ASL23. And the next step in the research to combine the health stakeholder of the key critical energy, identify system and look for based on the province. And this paper active organization governance for the place marking and community care manager and all place marking understand and the system is understood and analyzing the environmental factor in demography and also race, and also economic factor and the culture can be balanced, so keep holistic as possible. And thanks for your listening. If you have any or write me on.
Thank you. All right. We're totally on time, and we've got 10 minutes to discuss. And before you just quickly ask, you are obviously into a PhD project. You seem to, so you're probably about 1 to 2 years in, right?
Yes.
Ha, perfect. Okay. So yeah, important to understand when we give feedback, because obviously not solve a problem, but you right? And it would be quite important actually to, when you collect, to keep talking approach, a holistic approach. But when you show us this data here and data there, you kind of just walk through the numbers. How can you systemic framework?
The systemical is the this design framework, the 3-step, and also based on the the criteria, because step will be used this 5 key criteria, and also criteria type with my research, and then analyzing through the criteria and also the new criteria. So I say that based on this because, and also because design can be defined as designing that provide through the area with a holistic perspective, with support the stakeholder map. So
you hope to get from your, what do you think?
For my research in the future will be design for ASL23 community care, but also I will find a study in China, compare two systems suitable to different countries.
I could. Silvia also has questions. Beginning of a PhD, that's what I try to save the world. And you will probably realize you can do is actually just a, and you're in the process, everything. It's very interesting. Actually, you will have to probably come down to something. So I think by comparison we learn. But for this symposium is probably to discuss in your context. Obviously you have a very complex issue at hand with cannot be easily solved. Of stakeholders, you describe mine as the answer. Shouldn't that be a question? Can systemic design make a contribution, and how would it do a taming of the problem?
Yes, I think your suggestion is very interesting. And the weakness healthcare lie in the deep of the writing the implementation within a complex and the intended consequence change to the ocean even more proven has been actually cheap, and then it has narrowly addressed and castle and in the explore prior to measure being introduced and the require comparable to the big picture, including the interrelationship almost castle factor and the community and the complex attack complex theory has been recognized as the suitable approach. Then ocean is community, and also the John Peter also are playing complex adaptive system theory in the healthcare, of course, and for the similar design like the holistic tangible resource of the holistic dynamics and visualization of data and the priority set synthesize and map is also relation point of for the following projects in extension to energy to the enterprise, the complex of and is the energy but also there is not a golden one of the complex. Each one of them is there. They are so into the count clarity and sincerity and comprehensive openness animals. And I have say hopes search and the structure semi-structure interview surprise go well. You will probably next step of the research in know, but of course and our university is currently being used more for reforms and most naval office company. And these last 20 years we have worked with more than the 70 Italy on PhD degree thesis and degree design, and some of the projects are available on the lab website where video are posted. Also, so to design, but I think I didn't do save the all designer do a little.
Do you want to say anything?
Questions as well? Questions, but feel that I always do, and maybe
Yes, Guillermo, maybe you could ask a question for in your PhDs, you know, perspective on this.
It's such a tough leader. Yeah, I mean, but to be honest, I think that the feeling that we try put a lot of ingredients on the table, and toward you will try to ingredient to make a more solid and something even straightforward. So for me right now, the only as a PhD student in finishing line, let's say, is trying to reduce as much as possible. Need to stick with what you think for the outcome you may seek, referring to the research question that you probably already have a draft of the research. And that would, to be honest, do actually with the, yeah.
Okay, thank you.
I would like to observe is that you are now have a survey, and based once your work, will that lead to something that looks more like an intervention or something that looks more like of something else? Like what is this going to become?
Okay. For the this step, I have finished the semi-structure L2-3 managing, and for the next step, I will try to find organization to do interview for patient's perspective, the also, and then therefore for the holistic also increasing the flow of the information through the community and for the organization solution. So next step, or when I will and also collect data, I will be use this for organization the contribution of the stimulus design more variant and as also able to address the weight proven healthcare, and also justice.
Do you think healthcare is a problem that can be solved? We are in the wicked tame.
This is a very I think with proven not perfect solution to this problem, only
So to tame some problems that you are identifying, but at the same time you are trying to say this is more complicated with a systemic design approach. Looking into, like Guillermo said, out at the end of this project will really help you. At the moment you seem to be collecting, but what is more important than establish relationships so that you can then develop maybe new patterns, that you change your perspective. Overload on data only, not be able to do that. So it's not probably more about argue for a new perspective that other people will say, yes, this is the way we should be seeing it. And I'm not so sure which one exactly that will be. Maybe like in October. That's my impression. The world, but actually what you're probably interested in is something much smaller as the big picture.